Bridget Bothwell from Fort Collins is one of the Coloradans who's scrambling to help a neighbor find a vaccine. Wants to listen to what she has to say, and then another one of our neighbors has a specific question on this.
Hello, Governor Polis. I'm calling on behalf of my neighbour who will be 90 tomorrow. Why has she not got her vaccine yet? It is appalling, embarrassing, and totally unacceptable.
And Governor, you said today at a press conference vaccine providers may choose to prioritize higher risk older Coloradans when you open up the new wave of vaccinations to people next Monday. Nurse named Corrine Kreitzer wonders, why not require that vaccine providers continue to prioritize people 70 plus while they open up eligibility?
While the governor acknowledges disparities exist, is he then not creating a disparity for those 70 and older by opening up further groups before this group has had the chance to get the vaccine? As such, should there be policy to deter creating such disparity?
Sure. So let me be clear about why on February 8th we're expanding the eligibility to people age 65 and up. It's because at that point, knowing what we know about the number of vaccines we have, we won't have enough people 70 and up left that want the vaccine to fill up using all of that vaccines in every part of the state. There are parts of our state, communities, that have already effectively inoculated everybody 70 and up in the community. Other communities are not quite there. It might take a few weeks to get there, but we need that flexibility to have a broader pool. Here's what would happen if we didn't do that. If we stayed with 70 and up till February 20th or the end of February, we would simply not be able to administer as many vaccines as we could by expanding that group. So there's a plus and a minus to everything. Expanding the group leads to more people who might be frustrated that it's another week or two, but not expanding it from a public health perspective means a slowing rate of immunization, because once you reach that 50–60% of people age 70 and up, which we will reach right around February 8th, there are still people 70 and up that will want it and get it the week after that, the week after that, but there's not that flood of people that will allow us to fully deploy every vaccine the state receives within 3 days, which is our overarching guidance, so that we can end the pandemic as quickly as possible.
And I think, Governor, a lot of people understand that idea that you can't just like go looking for the last few 70 plus Coloradans while allowing vaccines to go to waste. But do you have it within your power and within the power of your health department to tell vaccine providers that if you have somebody who's 70 plus on your waiting list, you have to prioritize them over 65 to 69? Could you do that?
Look, I think that we will make it clear through, if we haven't already, and I'll make it clear, of course, we want to prioritize those who are most vulnerable. But what that generally means is appointments and most providers will be for people 70 and up, yes, but then they won't have enough appointments of people 70 and up to fill up all their appointments, and so also 65 and up. There's some areas where they might still take another week working on 70 and up. There's other areas where they've completed their 70 and up. They're ready to move to 65 and up today, but frankly, we're saying you can't. We want to get that vaccine to other parts of our state where we haven't reached the full protection for 70 and up yet. Wait one more week before you open it up to 65 and up.